Because of the fact I have a case that's actually set for trial in the Depew ASR litigation, I was forced to pay attention at a very detailed level to the issue of patient's tissue, as opposed to looking at the device, looking at the tissue. And because of that experience, we learned a lot. What we were finding in our early conversations with hospitals and pathology departments in the Stryker case is that when the tissue is removed from the patient, this dead necrotic tissue that's full of metal is removed from the patient, it goes to the pathology lab. And sometimes it's a fairly significant amount of tissue. The pathologist will slice up some of that tissue and create slides to look at under a microscope. And then we were finding out that in most circumstances, they were just throwing away the rest of the tissue. And so when our experts, our pathologists, set out to do their job, they asked for the tissue, and the tissue wasn't there. So all we had to deal with was the slides, because they do preserve those. So we've gotten a lot more sophisticated in talking to the pathology department, the risk management department, and the surgeon prior to the surgery to retain all of the tissue that comes out of the patient. Put it in formalin, put a top on it, preserve that for us as well. Because then we have a lot of flexibility with our own experts to look at the tissue. And there are a lot of studies that we can do that we weren't doing at the beginning to look at that tissue in very fine detail. Inductively coupled mass plasma spectrometry, EDAX testing or X-ray diffraction studies. But it takes tissue to do these studies. And you can't do those studies on the tissue that's on the slides. There's special stains that doctors can prepare to look at the tissue to exactly identify what the metal is that's in the tissue. So there's a lot of very sophisticated stuff we've developed, but you gotta have the tissue. So my advice to anybody that's facing revision surgery, whether you have a lawyer or you don't, is to communicate with your surgeon, the pathology department, and the risk management department of the hospital, and make sure they are on notice in writing that anything that comes out of your body gets preserved. It is possible that you could face pushback if you do that, but it's not going to be significant pushback. What we found is that as time goes by, hospitals, pathology departments, hospital administrators, and risk managers, it's almost part of doing business for them these days because there have been so many failed hip implants out there. They're much more familiar with these issues now than they used to be. It is not unusual for them to get a letter from a lawyer or from a patient saying, when you take that device out of me, keep it. When you take this tissue out of me, keep it. I would feel very comfortable as a patient writing a letter to your doctor, writing a letter to the hospital pathology department, and writing a letter to the hospital risk management department saying, whatever comes out of me, please preserve it, please keep it. It is 100% your right as a patient to have the hospital preserve any tissue or any device that comes out of you, just like it is your right to get your own medical records. In addition to the actual tissue that's removed from the patient, one of the things that we never really paid much attention to in the past is a lot of patients prior to the time of revision surgery during the workup, when doctors see fluid collections in the hip on MRI scan, some of them will order an aspiration of the hip to see whether or not that's an infection or whether or not it's adverse reaction to metal debris. And so you'll go in, you'll be put under anesthesia, the doctor will stick a needle in there and try to draw some of that fluid out of the hip. In the old days, we didn't pay any attention to that. Now, if I hear one of my clients is having an aspiration, or my clients are specifically instructed to tell me if they're going to the hospital for an aspiration, let me know. And what we'll do is we'll put the hospital and the pathology department on notice that once that fluid is drawn out of there, use what you need. Obviously, the medical use of this by the doctors and the pathologists is the most important thing. But once you use what you need, please preserve the rest of it, because we can send that out for analysis for metal concentration. We can look at the fluid and see what metal's in the fluid, and it can be powerful evidence.